The case we have from this morning is about drug eruption. There are many different kinds of drug eruption. Some examples include urticaria, fixed drug reaction, SGS, and TEN. The important part is to have an approach to drug eruption, rather than memorizing the details. In order to make the right diagnosis, you need to consider three factors. The first is clinical characteristics, including the morphology of the rash, like primary lesions, distribution and numbers of lesions. Then inspect the mucous membrane and assess the presence of any facial edema or lymphadenopathy. You also want to ask the presence of any systemic symptoms. Second is the timeline. The time interval between the start of the rash and the start of medication is crucial. Different drug eruptions have different characteristic timeline. The last factor is how common the medication can cause drug eruption. Let's apply those rules to our case. First is clinical characteristics. Our patient has a diffuse rash with numerous discrete and coalescing erythematous papules and plaques. It is a mobiliform rash, which means it resembles measles. The patient also has facial edema, fatigue, and lymphadenopathy, which will make you think the patient may have a more serious drug eruption. Second is timeline. The drug erupted about 4 weeks after the start of the medication. Last is medication. The patient is taking allopurinol, which is a common culprit for many drug eruptions. Combining all the clinical information, it should make you think of DRESS, which stands for drug reaction with eosinophilia and systemic symptoms. It is a severe idiosyncratic drug reaction that can affect many organs. The rash usually appears classically 2 to 6 weeks after the start of a new medication. Characteristic lab findings include elevated ALT and eosinophilia. Liver, kidneys, and lungs are the most commonly affected organs. Other organ systems that can be involved include heart, GI tract, pancreas, thyroid, brain, muscle, peripheral nerves, and eyes. So it involves multidisciplinary care for patients with DRESS. DRESS is just one of the many drug eruptions. When you are studying and encountering a drug eruption, think from the three factors of clinical characteristics, chronological factors, and how common the medication can cause drug eruption. Thank you for listening.